Okay, so big breath in, Sean. In.
These medical students at Newcastle University are getting some hands-on experience, a vital part of their training. Under the watchful eye of Dr. Matthias Schmidt, they're learning not just how to examine patients, but how to talk to them with compassion and respect. Their teacher says these skills are crucial for their development.
Tomorrow's doctor want to be the doctors that are trained absolutely perfect, and if I don't set a good example, if the medical school doesn't set a good example, then we won't be looked after well.
Sessions like this are an essential part in the training of medical students when they can learn from the experience of more senior doctors. But the problems arise when they witness behaviour they're not comfortable with and they don't know who to turn to for advice. Research carried out among hundreds of British medical students reveals that at some point most of them witness or take part in breaches of patient safety and dignity. They also report commonly experiencing abuse from senior doctors. This junior doctor, who doesn't want to be identified, was asked to carry out an intimate examination of a 14-year-old boy who was under general anaesthetic without the proper consent of the patient or his parents.
The sort of senior clinician supervising made it quite clear that we had to get on and do this because it was part of our clinical training. The difficulty is, without express consent or explicit consent, it's very hard to justify your learning needs overriding the dignity of a patient in that circumstance. It's also very hard after the event or during to actually report that to your seniors because it's seen as not demonstrating an appropriate level of deference for the clinician that was trying to help you advance your education.
For the authors of the research, the big concern is that a failure to treat patients with compassion and dignity may be subtly influencing the future behaviour of today's medical students.
Not necessarily the big, shocking news, the grabbing headlines. It's the things that can't be counted that really count.
Just looking into the symptoms a bit
Newcastle University Medical School has looked again at its training, but argues some students may not be prepared for what they have to face.
Almost the reluctance of medical students to get involved with intimate examinations because they almost felt that it wasn't legitimate for them to do so, whereas I think our perspective is, well, you might feel awkward, but it's something that's going to be really necessary for you as a qualified practitioner.
Tomorrow's doctors need to gain hands-on experience. Patients must be treated with dignity. This research shows that striking that balance is not always easy. Dominic Hughes, BBC News, Newcastle.